Thanks, James. Hi, everybody. I'm Lindsay Hammond. I'm the Policy Director at Restore Justice. So glad to have you here. We look forward to the conversation today. This is something we're going to continue to do about our policy priorities every other month. So look forward to your feedback and opportunities to do this again soon.
All right, we're going to get started. Next slide, Lizzie. So we just did a brief introduction. So the agenda for this webinar today is we're going to talk about what is solitary confinement. We got some good information and overview by the numbers more so. So we're going to have a deep dive into that. Then we're going to talk about why does this matter? We're going to talk about the impact of isolation on incarcerated people and the staff. And then, we're going to have some deep conversation with a few formerly incarcerated individuals that's going to give you some firsthand experiences talking about solitary confinement. And then ultimately, we're going to talk about solutions and then give you some take action opportunities to rise up. Like the song said at the beginning, this is something that is very important to us. So we definitely appreciate everybody that has joined us today. Next slide, Lizzie. So just a little bit about Restore Justice. We're a state level policy organization. We like to say that we're statewide. We go from tip to tip. We deal with extreme prison sentences that were with an emphasis on youth and emerging adults. We deal with families also. We have a CRIC family group, which is communities and relatives of Illinois incarcerated children. And we also have a FLAP program. Those are just two of the programs that we have. And FLAP is Future Leaders Apprenticeship Program. You will hear a little bit more about that a little bit later also. But that's just a little bit about Restore Justice. Next slide, Liz. So we basically have three focus areas. As you see, one is pathways to release, two is sentencing reform, and three is conditions of incarceration. We're going to specifically talk about conditions of incarceration today. We're talking about taking a look at solitary confinement, and you'll hear a little bit more about our Nelson Mandela Act, some legislation that we have going on in Springfield right now. But as you see, we do deal in retroactive youthful resentencing, and we deal with a little bit of accountability theory and mandatory minimums. But as I said today, we're going to specifically be talking about solitary confinement and the impact that it has on the individuals that are in solitary confinement and the staff. So next slide, Lizzie. So we're going to jump off into what is solitary confinement, and I'm going to pass it to my colleague. But before I do, I would love for people just to get a nice visual of the pictures that we have on this slide. And we were very intentional about putting this out there. As you see, these are segregation cells. Some cells have two individuals in them, some have one. But as you see, they're very desolate. And we just really, really want you to have that visual about what it is to deal with and to be in solitary confinement. So without further ado, we're going to jump off a little bit more into what is solitary confinement. Lindsay.
Thanks, James. We refer to this practice as solitary confinement. The Department of Corrections often uses terms like restrictive housing, administrative housing. It can also be called a segregation, the shoe, the hole. It has a variety of names. But essentially, solitary confinement is the practice of isolating people in a cell anywhere from 22 to 24 hours a day with virtually no human contact. And this can last for periods of days, weeks, months, or decades. Solitary is used as a form of punishment. I think it's maybe a myth that it's only used for really serious things, when in fact that's not the case. Solitary can be given as a punishment for anything, virtually. The staff has the opportunity to give a solitary confinement, and then a staff committee oversees the decision process to determine how long someone will stay in solitary confinement. So really a variety of things can get you into solitary confinement. It can be something as mundane as you have an extra deodorant stick, or you have something you're not supposed to have. There's huge ramifications for when somebody goes to solitary, just in terms of their livelihood within prison. People in solitary often lose access if they were working a job, if they were in school or some type of programming, they're removed from that. They're very limited in access to regular phone calls, to visiting with their families, to communicating with the outside world. Their property is often taken away. They're very limited in what they can have in the cell. And then when they are placed back in general population, it's not uncommon for some of their personal property items to no longer be available to them, like a fan or something of that nature could have been removed in that transition. So there's a lot at stake for someone being placed in solitary confinement, even if it's unfounded and they don't ultimately serve a long time there. It's very disruptive and traumatic. We wanted to give you a sense of numbers about how many people are impacted by solitary confinement in Illinois. Unfortunately, it's really hard to have really good data to get a true picture of it. We have this great analysis from our partners at Uptown's People's Law Center that looked at a period of time between 2011 and 2023 and identified more than 65,000 people spending time in at least 10 consecutive days of solitary confinement. Among them, 44 people were held for over 10 years. 11 of those people endured conditions for more than 12 years. Many of these individuals were between the ages of 26 and 50. And this is absolutely detrimental, as we're going to talk about the impact on people and the toll that it takes. We have been working really hard to be able to have more data about how long someone is held in solitary confinement. One of the tricky things is the status can change, and then it's hard to track how long someone is ultimately isolated. So they could be in an investigative period, they could be assigned to restrictive housing, and then move to extended restrictive housing. Throughout that time period, it's really hard to get a full picture. So earlier this year, we were really proud to work with Senator Peters and Representative Olicle to pass House Bill 4828, which created more data and transparency around solitary confinement. The first report from DOC about solitary was published in July of this year. You can find it on the DOC website under reports for restrictive housing. I will let you know, though, it is very limited in what it actually reports. It's missing a lot of data points, but it is a start, and we're really excited to have that data and for it to continue to come in. One of the things that you'll be able to see from this slide is what the data has shown so far is really the disparate impacts that solitary has on specifically Black people who are incarcerated in Illinois. They are incarcerated in solitary 7 times more likely than white Illinoisans in Illinois prisons, even though take into account the proportion of the population that is Black. We also have data that shows people with mental illness receive more misconduct than those without and are often subjected to isolation whenever their mental illness is exacerbated and they may be acting out in some way. Another really concerning impact of the population in solitary is individuals who identified as LGBTQ+. Oftentimes, they are placed also in isolation or solitary confinement instead of being given more protections in the general population. So these are definitely populations that are very vulnerable to this type of treatment. Solitary confinement also has a lot of fiscal costs involved that are important to think about as we're advocating for changes to the system. It is significantly more expensive to house a person in solitary confinement than it is in the general population. And this cost really comes from the nature of how involved staff have to be when someone is in solitary confinement. So for individuals that are placed on a solitary wing, officers are the ones that must come to the cells to bring food, put it in the chuck hold, deliver mail, hygiene supplies like toilet paper, other basic necessities, medicine. All of that must be done by correctional officers instead of other people who are incarcerated. Additionally, anytime someone is moved when they're in solitary confinement, there are 2 officers that accompany 1 person. So think about how much staff it takes maybe to move someone to take a shower or to go to a mental health treatment room if that's available to them, or a doctor's appointment, whatever it may be, hopefully time outside. All of that, though, is very staff intensive and expensive. The other thing that is really important to note that I hope you take away from today is that there is no peer-reviewed research that shows the using of solitary confinement makes our prisons safer. So we have spent so much time and money invested into this really horrible, traumatic system that is not actually helping. And in fact, there's a lot of data to show it may make things worse as people are traumatized. That results in more trauma and more violence and more difficulty managing emotions because of that isolation. We are people who are meant to be in community, who are meant to be around other people, and depriving people of that is not the right way to be able to increase safety in our carceral system. Solitary confinement is not new to the United States. It's been around since the 1800s. Because of that, we have over 150 years of research and data pointing to the harmful effects. We have experts in the law, experts in human rights, experts in mental health, in medical resources as well, all coming to the same conclusions that solitary confinement is psychologically and emotionally harmful for people and has serious, long-lasting effects, which we'll talk more about today. Nelson Mandela is one of the most famous people who has been subjected to solitary confinement for over 2 decades. He was placed in solitary confinement. He described it as the most forbidding aspect of prison life, with no end and no beginning. For Nelson Mandela, it was the worst part of his imprisonment. Recognizing the devastating impact this had on him and others, the United Nations created a standard of how people who are incarcerated should be treated. And several of those standards have become known as the Nelson Mandela Rule and deal specifically with solitary confinement. These rules that we call the Mandela Rules specifically define solitary confinement in excess of 15 days. So holding somebody for more than 15 days at a time in solitary confinement to be torture. So we'll dig into that more as we go along. And I'll pass it to James now to tell us more about why this is important and why it matters.
Thank you, Lindsay. So we just want to give you just a vision of how this impacts people who are incarcerated and why this really matters. Lindsay just gave you the numbers, but like, as research shows that even a single week in solitary can definitely cause neurological changes. I've seen this personally happen with individuals. Prolonged isolation, it definitely has serious and lasting effects. And this is something that can be part of a person's reentry, right? How we treat people while they're incarcerated matters for when they come home. And this is something that is actually going to impact their families. It's going to impact how their reentry path is when they're dealing with employee trying to get a job, their health, and the communities that they return to. So that is a very big impact for the people who are incarcerated because it goes well beyond incarceration. So next slide, Lizzie. And we really don't think about it from this aspect, but correctional staff actually has trauma behind this also. You know, they're also always in a state of hypervigilance. They're always on alert. I've actually seen this personally myself with staff that, you know, I interacted with. You know, they act totally different once they go to work in solitary confinement and come back out to general population just because of the impact that it has. You know, it's a lot of screaming. You know, they encounter individuals who self-harm themselves, feces covered cells, you know, and this leads to, you know, staff experiencing, you know, high rates of heart disease and PTSD. You know, this is one thing that we don't think about because they are also affected, by the things that go on in solitary confinement. And they actually do take that home also. So that's just something that we like to let people know about also. Next slide, Lizzie. Now, this is just some national data that we came across and that we would like for people to know. Came from our friends at Vera Institute. Just some of the things that the Department of Corrections here experience, and the national rate. The national rate is in blue, and as you see, the red part is the Department of Corrections. So you see, they actually do experience depression, PTSD, and high rates of suicide. And the life expectancy is 16 years shorter. So they go through the same thing also, but that is one thing that we're trying to, bring to light, that this affects more than just the incarcerated people. And this is why, we need to bring this to light. So right now, we're going to take the time and we're going to dive off into some firsthand conversation. And we're going to hear from Joseph Moore, who is a former RJ apprentice and a former IPP, Illinois Prison Project ambassador, who is now a diversion and reentry policy analyst with Access Living. He works to identify and advocate for best practices that divert people with disabilities away from carceral settings. And we're also going to hear from Brian Bills, a current apprentice at Restore Justice, who was exonerated after serving 35 years. He's the founder and director of Mud Theater Project, a nonprofit that produces their own original plays. And it started at Dixon Correctional Center as a performing arts program. So we're going to dive off into some questions, and we're going to try to have some casual conversation with Joseph and Brian. Thank you guys for sharing your time with us today. So Brian, I'm gonna jump right into it, and I'm gonna ask you, how has solitary confinement affected you while you were incarcerated, and have you noticed any lingering effects since you've been home?
Yeah, thanks, James. When I remember like going to solitary confinement, to walk back there, knowing that you were going to be strip searched and knowing that you're leaving all your property behind, that the rising anxiety about whether or not you will receive your property, how long you stay, whether or not whatever charge that sent you to segregation was going to be adjudicated properly, and then put in isolation. Usually you would start off in one of the cells that we refer to as behind the door, where it was not bars. And so it's like a complete isolation from even light. And the only opening would be the chuck hole where they would slide the food in, and just sitting there for the first few days, just trying to acclimate, particularly the first time was like really, really tough. And, you're trying to figure out, how can I cope with this? Am I going to be able to explain whatever it is that happened? How much you lose? Because I was a person, particularly early on, who was allowed to work and go to school and be in programs and be a program developer inside. Had a community of really good friendships, and to be taken away from that. Um, Coping, one of the things that I would do was write like really, really long letters to my family, like just playing over in my head, like things that I wanted to say. And then once you exhaust those letters, which probably takes a couple of days because you're trying to write everybody. And then when you get the property that they're allowed to give you, which is usually just writing material and write outs, letters that we can send out. And once you exhaust that, you start playing things over and over in your mind to just pass the time. And as far as lingering effects, like that, the numbness that, you wanted to feel numb because isolation is painful. Isolation, the social deprivation of it was, really difficult to cope with. So you just revert back into your head and relive past experiences over and over and over again. And it becomes easier and easier to slip into that state. Even today, sometimes when I'm faced with, a lot of adversity in life in my reentry journey, I find myself slipping into that state where I feel frozen in time, and I have to like wake up out of it to get back in action and start solving problems. And that is one of the lingering effects of that isolation, and I still cope with today.
Yeah. Thank you for that answer. I definitely can understand that. When you're incarcerated, you literally sometimes have to find ways to get away from that harsh reality. So I appreciate you painting that picture. So Joseph, there's a misconception that solitary confinement is often utilized for serious situations such as assaults or someone being harmed, but we know that's not often the case. Can you share some examples of people being placed in solitary confinement for smaller disciplinary infractions, and how common is that in your experience?
It's very common. It's very common for people to be placed in solitary confinement for minor disciplinary infractions. Something simple as when you're on a walk, it's called mass movement. So you may be going to the chow hall, to the yard, or the gym, or to the commissary. And if you're not walking in lockstep with the person that's next to you, in lockstep, you go to solitary confinement for 30 days. For 30 days, you'll be placed in segregation for just not walking in lockstep with somebody. Having excessive property, which is something that Lindsay had mentioned earlier, having three deodorants instead of having one deodorant, right? Refusing housing. There may be a situation where a person feel as though they're not safe in the cell with someone else and they refuse to go in that particular cell. They will be placed in isolation. Many of the facilities, most of the facilities throughout the state of Illinois, and specifically those that I've been in, they really don't meet ADA accommodations, right? So for people with disabilities, mental illnesses, and physical disabilities, being that the prisons don't have the accommodations for them, they place them in solitary confinement. It's people who are on walkers, people who are on crutches, people in wheelchairs are placed in solitary confinement because the prisons don't have the aren't able to accommodate them. But yet and still, although they didn't commit a disciplinary infraction, the repercussions and the adverse effects of being in solitary confinement are the same. So those are a few instances when people, will be placed in solitary confinement without it even being a major infraction.
I appreciate that, Joseph. I know you referred to having too much property. I know of instances myself personally where individuals have been placed in solitary confinement for literally having salt packs in their pocket on their way back from the child hall. So that's one of those instances also as to where it definitely is used as a tool, and it's very punitive and it causes so much damage and ultimately, you're uprooting the individual from general population and putting them in a whole nother world. So with that, I
But
want
let's
to.
let me but I think let's explain that the salt packs aren't stolen salt packs. The salt packs are given to you. And yet, if you leave the child hall with them, you will be taken to SIG because you had the salt packs and placed in solitary confinement. So it wasn't a
Exactly.
theft. It wasn't a theft. Right.
Right, exactly. With a small infraction where it really literally has nothing to do with safety and security of the institution, which is what they always categorize things such as. But thank you for that, yo. I appreciate that. But Brian, I wanna go back to you a little bit. I know you spoke with towards how you cope with solitary confinement, but I know I spoke of earlier that isolated confinement and segregation is a completely different world. Like I wonder if you could speak a little bit more towards an actual day in segregation, like the noise, the how you have to deal with other people, the way that they deal with things and how they cope. Literally can deal with how you cope with that. I wonder if you could speak towards that a little bit.
Yeah, so they are like, let's talk about solitary confinement on different levels. In the maximum security system, solitary confinement is in the bars, pretty much like you depicted in the slides. And it can be a little more social, but you have men who sleep during the day, men who sleep in the afternoon, and men who sleep at night. And then the rest of it is just active. So you have to like pick and choose because there are people back there suffering and making noise and, like the constant noise of it. And you hear, it's not like just regular conversations. It's people actually crying out in pain. And then when you hear officers coming in to quiet someone, and you can actually hear the beating thuds of a body being punched, and you can, and then you imagine like in solitary confinement, you get a shower once a week, if everything is running normally, and trying to wash up in those little sinks that you depicted, and not having an abundance of material, and then depending on the temperature, the weather, the season. In the summertime, being in solitary confinement, where you're sweating profusely, or you don't have a lot of towels, or you just have one towel, you just have one change of underwear, and you just have two t-shirts, and you have a jumpsuit. If you're fortunate enough to go to SED, when you have some shorts on, you may be able to keep those shorts. But imagine always being in your underwear around the clock, just trying to keep cool. Or the adverse in the wintertime, when the concrete walls get so cold that you literally feel like you're living in a refrigerator, and you just got that one wool blanket, and you're reluctant to send it to the laundry because it may not come back, and then you really in a bad way. But yeah, I was talking about different coping mechanisms early on. I think particularly when I was a young man I was doing SED time, a little frequently than I did as I got to be older in the system. But the first time I got a year in SED, and just like the norm is think about how long, when you do that first day, then you think, well, wow, it's 364 more of these first days. Then you try. I would look at it as, imagine walking up to a cliff and then looking on the other side and not seeing the bottom. And ultimately, as the time go on, you're starting to see a little visions of a bottom, but it's all so mentally draining, and just taxing, trying to, just being deprived socially, not being in contact with your family when you get used to getting a phone call or two, every week to check in. And now you're completely out of touch with everything and everybody that you care about. And then getting out is also traumatic because things have moved on. People that you might have been close to, they have transferred, or doing other things, and new people have come into this really small ecosystem of a unit that you live in, and you may not go back to that same unit. So it's starting all over again, getting in the job pool again, and it's so much or even getting back in class, or you go to SED and you in school and you don't get a chance to finish that class, and just getting back in school is a problem, but you lose your credits for that class. And I'm not trying to say like SEG is an arbitrary thing. Sometimes, like you actually do something, but you have to get that time out, but the time out is abused. It's far too long. It doesn't take a person to sit and SEG for a year to feel like, what, I made a mistake. Give me a second chance. The amount of times are fixed. There is no follow-up to see if you actually feel some type of remorse, or if you actually make an adjustment, or if you understand what you did wrong to be put in segregation. It's just a fixed time. And every situation is different. What causes you to go to SED? Like one of the ones that Yosei brought up is about being transferred to a cell where it's just impossible to get along with this person. And then administration's response is, well, then you got to walk yourself to SED and start all over again. I remember early on, walking yourself was 15 days, and then it became 60 days, so even that was a punishment. But no, that's coping mechanisms, man. For me, I tried to turn it to a strength when I started writing. That's when I first started imagining myself as a writer, and started going through those scenarios, and start writing little short stories, and ultimately writing plays, to pour out that pain onto the pages, to transfer it out of myself, transfer it out of my mind and my body. I think a lot of guys probably use that as a coping mechanism, turning something that was painful and distressing into a strength in the long run. And to hear men talking to themselves all day and all night, just for a sheer loneliness, And yeah, it's you bringing up a lot of memories. It's hard to think about that.
Yeah. Yeah, I appreciate that. I just want to make sure that people understand that, it's so much more that comes with segregation. Can you kind of like highlighted a few points as to where, individuals can be uprooted for something as small and something as like Joseph was referring to as a salt pack, and now, you may lose the education aspect that you've been doing. You may lose the position where you were at in your cell house, to where you were able to be more social and to do more things. And now to be put in the isolation aspect as to where you have to learn how to cope with so much other stuff. So I appreciate that, you bringing that to light, Brian. But Joseph, this webinar is entitled "Ending Torture by Solitary Confinement." If you could you elaborate a little bit on why is solitary torture?
Why solitary torture? Oh man, it's um back to something that Lindsay said earlier in the slides as well, how we just as human beings, we are social. We are social people, right? By nature, we are social. And to lock someone in a cell by themselves for an extended period of time, deny them, the ability or access to social, I have meaningful social contact with someone else, has so many different repercussions, right? From psychological repercussions, physical repercussions, emotional repercussions, and why and but although those are the things that will make it torture, I think the thing that really makes it torture is that we know this. It is so much science that says that solitary confinement is harmful, that it harms people, and we still do it, right? Even when it was in the 19th century, even when the Supreme Court ruled that prolonged solitary confinement, it caused its harmful psychological effects to people. And yet here we are more than 100 years later, and we still subjecting people to this cruel, and I would like to say unusual punishment, but it's not unusual because we use it throughout prisons throughout the entire United States. Although it's cruel, it's not unusual. My experience with the times I have spent in solitary confinement, I had done two 6 month stints and a 3 month stint. On both of my 6 month stints, one was in Stateville and the other one was in Galesburg, Henry Hill, CC. On both of those occasions, someone committed suicide. Someone took their lives. When I was in solitary confinement for that 3 month stint, several people attempted suicide. They weren't successful with the attempt, but what they did do was commit self-harm. They harmed themselves. And this was a result of being in solitary confinement. Solitary confinement, when it relates to prisons, more people commit suicide in solitary confinement than they do in the general population. That in and of itself says a lot. When we think about, because I was in prison during COVID, when COVID-19 happened. And I remember hearing on the news how the rates because of the isolation, because people couldn't simply leave their homes and go about their daily lives, the suicide rate in society had increased dramatically. So just imagine someone being placed in a box, and I wouldn't want to inconvenience Lindsay or run the show, but if they could show that collage of the solitary confinement cells again, I would appreciate it. But if it be too much of a problem, then no. But just imagine.
It'll come back up.
But just imagine being held in those cells for months on end, for some people years on end. Look at those cells. People are held in those cells alone for months on end. Some people for years on end with no meaningful human contact. And so they begin to deteriorate psychologically. There's even studies that say that certain regions of the brain physically shrink if a person has to be in solitary confinement for a prolonged period of time. So that's why it's torture. It is truly torture because we know that it's harmful, and people are still subjected to it. And when I mean we, us as a society, and people, and especially the criminal legal system, and they still subject people to solitary confinement.
You're definitely right. Thank you for that, Joseph. So we're gonna bring this conversation to a close, but I want to give a question to both of you, more so, and kind of wrap this up. What else is important for people to know about solitary confinement? Any one of you guys can go first. Just what would you like people to leave with after hearing this conversation right now?
Well, I would say that I would like people to know that solitary confinement does not improve the safety and security of prisons. As Lindsay said earlier as well, there's no peer-reviewed study that says that solitary confinement makes prisons and jails any safer. None at all. And although that is the reasoning behind it, it is false. It actually can make prisons less safe because the people who are being subjected to solitary confinement, the psychological and emotional effects toll that it has on them can put them in a place mentally and emotionally where it's, I'm not going to say impossible, but it becomes difficult for them to cope when they are released from solitary confinement back into the general population or is released back into society. When people are released from solitary confinement, and they and no one has an experience with the criminal legal system and come through it unscathed. Period. Everyone who has been to prison is scathed to some degree. But those who have spent time in solitary confinement, their scathing is to a much greater degree than someone who hasn't. And it even makes it difficult for many of those people to cope well when they return home. So we understanding that 90%, 95% of those who are incarcerated will return to society. We would like for those people to return as suffering as with the least amount of harm as possible. And an experience with solitary confinement, it doesn't provide that. But, and I'm gonna end right here. Solitary confinement does not improve the safety of prisons. I think that's what I truly, truly want to get across. It causes more harm than good.
Yeah, I'm
Thank you,
just gonna add
Joseph.
a little bit more context to that too. Like going in the system in the 1980s, where it just wasn't the same kind of society that it is today. And later, during my incarceration, my time in confinement, I became a paralegal and was tasked to going back into the segregation units and helping people who needed legal work or had legal deadlines or to challenge whatever legal situations they were going in. And this is, it's not too, 2023. So it's not a long time ago. And as younger and younger people were coming into the system who came up in a different society where, you had the internet and you had social media and just noticing, I have no like legitimate case studies, but just experiencing and seeing this, that young people back there in segregation literally going crazy. I mean, like harming themselves for attention, cutting themselves, any opportunity, just screaming incessantly for hours and hours on end, refusing to eat, just begging for attention, putting in requests to the law library just so someone could come and talk to them about non-existent legal matters. And so, part of that assignment was putting on, your quote unquote, your trauma therapist hat and just spending time to talk to people and having officers like run you off, try to limit the amount of time that you spend at a cell just to give somebody that little bit of extra socialization that I knew they needed based on my experience in segregation, that even the officers knew they needed, because part of the times, one of the reasons they so stressed out and having these heart problems and stuff, because they deal with that on day in and day out as well. And seeing that human suffering is transferred into their bodies, into their psyche. And just thinking about that, like there has been no adjustment in terms of, let's reduce it. It's only getting longer. Every time IDOC comes out with new guidelines for whatever disciplinary infraction, it hasn't been lessened. It's always extended. And they're finding ways and reasons to, extend things for like that a few years ago or a decade ago didn't have that amount of seg time attached to it is going in the wrong direction. And I'm hoping that if you take nothing else away from this conversation, that you feel empowered or feel motivated to at least ask the question, so why is that, when we know through the studies that have been conducted that is harming people? Like when you see somebody being seg so long that they don't want to leave segregation, you know, and like literally have to be put out of segregation because their socialization level has gotten to the point where they don't even feel like they can cope in a general population setting anymore, then you know that it's damaging. But hopefully the reports, if they get a little bit more accurate and a little bit more precise, will start, showing incidents of that. We have to ask the right questions if we want the right answers. So if nothing else, through coalition building, let's start asking the right questions so we can get the right answers and start helping people instead of harming people.
You said, thank you, Brian. I appreciate that. And I just want to thank you and Joseph again for coming and sharing those lived experience. I know it's not easy to talk about those kind of things, but it's all a part of the work and more or less educating people. So right now, what we're going to do is we're going to go into the next section of this webinar. We're going to talk about some solutions, and we're going to give you guys some take actions, some opportunities to get involved. So I'm gonna pass it to my colleague Lindsay to get off into that a little bit more.
Thank you, James. And I just want to add my thanks to Brian and Yosef truly for your openness to sharing your experience. It's so important. Let's get into a bit of hope. Let's talk about solutions, alternatives, things that are working in other states. And to do that, we need to start with Colorado. In 2017, Colorado became the first state to end the use of long-term solitary confinement. They actually enacted the Nelson Mandela Rules, limiting the use of solitary to 15 days at a time. It requires people to receive at least 4 hours of therapeutic programming and 1 hour of recreation out of their cell every day. This is coupled with what they call their step-down program. So if someone is actually placed in solitary confinement in Colorado, they have wraparound intense mental health services that are really trying to address what is the root cause of why that person is in solitary confinement. This grows out of the leadership of Rick Ramish, and appreciate Lizzie just putting into the chat an incredible op-ed I highly recommend from the New York Times. Rick Ramish lays it out, why Colorado ended long-term solitary confinement. He speaks to the human cost, to the harm that it was causing, and also how effective it's working. It's successful. It took a lot of work. It took a lot of buy-in from staff to be able to implement it. But once staff started seeing a difference, it really was life-changing to people in the department. At the time of that op-ed, I think he mentions Colorado only had 18 people in solitary confinement. So to give you an idea of how drastic a change that was. Also want to bring to your attention some legislation passed by other states. New Jersey in 2019 was able to pass restrictions for solitary confinement, requiring people to have 4 hours out of their cell for people in prisons through the Isolated Confinement Restriction Act. It also prohibits people from being in solitary confinement for more than 20 consecutive days or longer than 30 days during a 60-day period. Connecticut followed in 2022, passing the PROTECT Act. Their statute limits the number of days a person can be held in solitary confinement to no more than 15 consecutive days or 30 total days within a 60-day period. This provision applies to people who are being held pre-trial, pre-sentencing, or post-conviction. The PROTECT Act in Connecticut also created an independent ombudsman position to investigate complaints about the Department of Corrections. It requires people in solitary confinement to have 2 hours out of their cell. And it also looks at the conditions of solitary confinement. So in Connecticut, people are required to have access to reading materials, to paper and a writing implement, to at least 3 showers a week, which is a lot more than Illinois, a minimum of 2 hours per day out of cell, including 1 hour for recreational purposes. Another significant piece of legislation New York passed is called the HALT Act. In 2022, it stands for the Humane Alternatives to Long-Term Solitary Confinement Act. New York probably has the strongest limits in a state law in our country right now. People who are in solitary confinement up to 15 days are required to have 4 hours a day out of their cell. If they're held longer than that 15 days, they get 7 hours out of their cell. Anybody who is held for longer than 15 days goes through a robust review process to ensure that that is necessary for that individual. New York also has a lot of exceptions to people who cannot be in solitary confinement. So New York does not allow people who are 21 years of age or younger, 55 years or older, living with a disability, pregnant, postpartum, or caring for a child to be able to be held in solitary confinement. And that's caring for a child within a correctional institution. The HALT Act in New York also restricts the use of solitary for people diagnosed with a serious mental illness. For people that are placed in solitary confinement, they've created what they call a residential rehabilitative unit that is a separate housing unit specifically used for therapy, treatment, rehabilitative programming of people who have determined to be requiring more than 15 days of solitary confinement. This leads us into what we're trying to do in Illinois. So let's talk about our Nelson Mandela Act, which is Senate Bill 65 and House Bill 1428. It's the exact same language filed in both chambers of the Illinois General Assembly. We are really excited to work on this legislation with our great partners at Uptown People's Law Center, Access Living, as well as the Chicago Lawyers Committee for Civil Rights. This bill, the Nelson Mandela Act, would bring Illinois into compliance with the Nelson Mandela Rules. Everyone under this legislation would be allowed out of their cell for at least 4 hours a day. People who need to be kept in their cell for 20 hours a day or more would be limited to only 10 days within a 6-month period. Additionally, the Nelson Mandela Act also has restrictions for vulnerable populations. So people who are under 21, over 55, have a disability as defined by the American Disability Act, or are pregnant or postpartum would not be allowed to be in solitary confinement. What's important to note is that in Illinois, we have absolutely no restrictions whatsoever currently. So right now, people can be held even if they're within those vulnerable positions for an unlimited amount of time. There is absolutely no restrictions in our state law. So the Nelson Mandela Act would be huge in creating some protections for people who are incarcerated in our prisons in our state. We invite you as one opportunity that we hope you'll take away from this to reach out to your state legislators about the Nelson Mandela Act. You can use a take action that we'll put in the chat where you can email your state rep and state senator. You can also call or meet with them. We'd glad to join you or give you more information if you'd like to do that. But please let them know that it's important that they support the Nelson Mandela Act, that they co-sponsor it, and they help us with this movement for change. One additional way you can be supportive of the Nelson Mandela Act is if you're part of an organization and you'd like to endorse the Nelson Mandela Act and say, we as an organization support this, let us know too. We'd be so glad to add you to our list of organizations that are in support of this significant change. In addition to legislation, we have a lot of incredible events coming up we want to bring to your attention. Just next week, there's going to be a virtual Isaiah 61 Summit. It's a gathering of faith leaders from across the country and locally in Illinois, talking about mass incarceration, particularly solitary confinement. Brian, who you heard from earlier, and I will be panelists. So we invite you to join that. It's open to anyone. It's free to register. We'll also share the link. Another incredible event happening the following week, October 9th and 10th, is the Journey to Justice bus tour. We are so excited that we have this incredible partnership with Unlock the Box campaign, which is a national organization committed to ending solitary confinement. and the National Religious Campaign Against Torture, bringing this bus tour across the country. And there's going to be 3 different events from the south side to the north side to the west side of Chicago to bring attention, community around this. The bus is going to be an incredible experience for people to interact, to learn more about it. And then our own Brian Beals has been diligently planning a lot of art and activism opportunities to go along with that. So Brian, I'm going to invite you to give us a little bit more information about what to expect at each stop, starting with Undercover Books.
Thanks a lot, Lindsay. Yeah, Undercover Books will be the stop on the far south side of 103rd Street. There's going to be broken down into 3 different sections. The bus is its own experience, and the bus will be at each one of the stops. So going through the bus, learning about solitary confinement movements across the country, hearing live projects and seeing and learning about different legal aspects of solitary confinement legislation across the country. Also, at Undercover Book Stop, we're going to be at Culture Canva, and there is going to be an exhibit of a live sale that people, a mock sale that people will be able to walk in, experience, and see what it actually feels like to see it with their own eyes. And inside the bookstore, which is connected to the Canva Cafe, is going to be live storytelling about formerly incarcerated people who did a lot of time in solitary confinement. We're going to do some demonstrations of some of the activities that we would do to try to pass the time in segregation. And it's just going to be a really like low-key, chill, experience it from the bus, experience the cell, hear from people who are directly impacted about solitary confinement and their time in it. With DePaul, it's going to be a little bit of a different atmosphere. It's going to be a panel featuring James and several other policy people and people who are impacted by both from inside as a family member. Stanley Howard, who just recently had an article published in the Sun-Times about his experience in solitary confinement. We're hoping to get some legislators who support the Nelson Mandela Act come in and talk about, why they support the bill, and also, again, the bus experience, same thing, but it's going to be a call to action where after you have this panel, we're going to define some steps that you can take to help join the movement to limit the abuse of solitary confinement. The following day on the west side, south, northwest, is going to be a Walls Turn Sideways, where you're going to see some projects, some stopgap animation projects that were done with Sarah Ross and formerly incarcerated people making animations that depict what they went through in solitary confinement. I had the opportunity to witness and see a couple of these animations, and they're really, they're really emotional, honestly, and just being able to use art as a way to express what that feels like. And you're going to have an opportunity to talk to those artists who did those animations. You're going to have a live performance by a couple of Mud Theater poets. And it's just going to be a really good wind up of the bus tour, and outlining what steps you can take currently right now, and just giving you the whole experience from both policy analysts, organizations working to stop the abuse of solitary confinement, and people directly impacted and spend time in solitary confinement coming together to spearhead this movement to get the Nelson Mandela Act passed into law.
Appreciate that, Brian, for that thorough breakdown. I'm definitely looking forward to it. This is something that we've all been working to get across. So hopefully everybody can join if they can. There's definitely going to be a lot of good things going on. But just to let you guys know, we would love for you to connect with Restore Justice. You can join our advocacy team. And what basically our advocacy team does, we come together every Friday during session, which is from January to May, from 12 to 12:30. And we give updates on what's going on in Springfield, not only with our legislation, but with any legislation that's going on with the issues that we deal in. We also give people tasks such as the things that we've asked today. And we do a little how-to. We show people how to navigate the websites that we ask people to go to get their information from. So those are just a few of the things that we do on the advocacy team. And also we have the action team, which is with our sister organization, Restore Justice Illinois. And this is completely voluntary. Everybody that is involved at Restore Justice volunteers. And this is just a way that we go out and support those legislators that support us by knocking on doors. Right now, we're in the process of helping legislators get signatures so that they can get on the ballot. We actually have something that's coming up on September 27th, I think. We are knocking doors and getting signatures for Rep. Morris. So these are the kind of things that we do on our action team. And if this is something that you would like to get involved in, you definitely can go to Restore Justice Illinois and take action and sign up for that. So those are just a few things that we would love for you to connect with at Restore Justice. Um, so next slide, Lizzie. And this is the information of myself, my colleagues, Lindsay and Brian. If anybody would like to get in touch with us, any questions that you may have. I see that there were some questions in the chat, and I think we took the time to answer all those questions. So I think we just would love to say thank you to everybody that attended more so and learn some things. I hope we gave you guys some things to think about, some actions that you would like to consider, and hopefully we will see you guys at some of the stops that Brian and Lindsay spoke about and taking action. And I just want to say thank you and have a good rest of your day. And we appreciate you guys coming out to learn with us. I don't know if any of my colleagues want to say anything, but I definitely want to say thank you, and I appreciate everybody that came out with us this afternoon.
Thanks, everybody. Have a great day.